Breast cancer. Breast cancer is a cancer that forms in the cells of the breasts. The most common cancer diagnosed in women is skin cancer, followed by breast cancer. Though breast cancer can occur to both men and women, it's far more common in women. Symptoms: change in the size, shape or appearance of a breast. A breast lump or thickening that feels different from the surrounding tissue. Changes to the skin over the breast such as dimpling. A newly inverted nipple. Peeling, scaling, flaking or crusting of the pigmented area of skin surrounding the nipple or breast skin. Redness or pitting of the skin over the breast like the skin of an orange. Causes: breast cancer occurs when some breast cells begin to grow abnormally. These cells divide more rapidly than healthy cells do and continue to accumulate, forming a lump or mass. Cells may spread through your breast to your lymph nodes or to other parts of your body. Breast cancer most often begins with cells in the milk-producing ducts called invasive ductal carcinoma. Breast cancer may also begin in the glandular tissue called lobules or invasive lobular carcinoma, or in other cells or tissue within the breast. Research has identified hormonal, lifestyle and environmental factors that may increase your risk of breast cancer. But it's not clear why some people who have no risk factors develop cancer, yet other people with risk factors never do. It's likely that breast cancer is caused by a complex interaction of your genetic makeup and your environment. Inherited breast cancer. Doctors estimate that about 5 to 10% of breast cancers are linked to gene mutations passed through generations of a family. Risk factors. Factors that are associated with an increased risk of breast cancer include: gender. Women are much more likely than men are to develop breast cancer. Age. Your risk of breast cancer increases as you age. Personal history of breast conditions. If you've had a breast biopsy that found lobular carcinoma in situ or a typical hyperplasia of the breast, you have an increased risk of breast cancer. A personal history of breast cancer. If you've had breast cancer in one breast, you have an increased risk of developing cancer in the other breast. A family history of breast cancer. If your mother, sister or daughter was diagnosed with breast cancer, particularly at a young age, your risk of breast cancer is increased, but also majority of people diagnosed with breast cancer have no family history of the disease. Inherited genes that increase cancer risk. Certain gene mutations that increase the risk of breast cancer can be passed from parents to children. The most well-known gene mutations are referred to as BRCA1 and BRCA2. These genes can greatly increase your risk of breast cancer and other cancers, but they don't make cancer inevitable. Radiation exposure. If you had radiation treatment to your chest as a child or young adult, your risk of breast cancer is increased. Obesity. Being obese increases your risk of breast cancer. Beginning your period at a younger age. Beginning your period before age 12 increases your risk of breast cancer. Beginning menopause at an older age. If you begin menopause at an older age, you're more likely to develop breast cancer. Having your first child at an older age. Women who give birth to their first child after age May 30th have an increased risk of breast cancer. Having never been pregnant. Women who have never been pregnant have a greater risk of breast cancer than do women who have had one or more pregnancies. Postmenopausal hormone therapy. Women who take hormone therapy medications that combine estrogen and progesterone to treat the signs and symptoms of menopause have an increased risk of breast cancer. The risk of breast cancer decreases when women stop taking these medications. Drinking alcohol. Drinking alcohol increases the risk of breast cancer. Prevention. Making changes in your daily life may help reduce your risk of breast cancer. Ask your doctor about breast cancer screening. Discuss with your doctor when to begin cancer screening examination and tests like clinical breast examination and mammograms. Become familiar with your breast through breast self-examination for breast awareness. Breast awareness can't prevent breast cancer, but it may help you to better understand the normal changes that your breasts undergo and identify any unusual signs and symptoms. Drink alcohol in moderation if at all. Limit the amount of alcohol you drink to no more than 1 drink a day if you choose to drink. Limit postmenopausal hormone therapy. Combination hormone therapy may increase the risk of breast cancer. Discuss with your doctor about the benefits and risks of hormone therapy. Maintain a healthy weight. Choose a healthy diet. Diagnosis, tests and procedures that are used to diagnose breast cancer include mammogram. This is an X-ray of the breast. Breast examination. The doctor checks both breasts and lymph nodes in your armpit, feeling for any lumps or other abnormalities. Breast ultrasound. Ultrasound uses sound waves to produce images of structures deep within the body. It's used to determine whether a new breast lump is a solid mass or a fluid-filled cyst. Biopsy. This involves removing a sample of breast cells for testing. Breast magnetic resonance imaging. An MRI machine uses a magnet and radio waves to create pictures of the interior of your breast. Treatment. Your doctor will determine your breast cancer treatment options based on your type of breast cancer, its stage and grade, size, and whether the cancer cells are sensitive to hormones. Most women undergo surgery for breast cancer, and many also receive additional treatment after surgery such as chemotherapy, hormone therapy, or radiation. Breast cancer surgery. It includes removing the breast cancer, also called lumpectomy. The surgeon removes the tumor and a small margin of surrounding healthy tissue. Removing the entire breast, called mastectomy. Most mastectomy procedures remove all of the breast tissue. The lobules, ducts, fatty tissue, and some skin, including the nipple and areola. Removing a limited number of lymph nodes, also called sentinel node biopsy. The surgeon will remove the lymph nodes that are the first to receive the lymph drainage from your tumor. If no cancer is found in those lymph nodes, the chance of finding cancer in any of the remaining lymph nodes is small, and no other nodes need to be removed. Removing several lymph nodes, called axillary lymph node dissection. If cancer is found in the sentinel lymph nodes, your surgeon will discuss with you the role of removing additional lymph nodes in your armpit. Removing both breasts. Some women with cancer in one breast may choose to have their other healthy breast removed. The process is called contralateral prophylactic mastectomy. If they have a very increased risk of cancer in the other breast because of a genetic predisposition or strong family history. Breast cancer surgery carries a risk of pain, bleeding, infection, and arm swelling called lymphedema. Radiation therapy. This is done using high-powered beams of energy such as X-rays and protons to kill cancer cells. Side effects of radiation therapy include fatigue and a red, sunburn-like rash where the radiation is aimed. Chemotherapy. This uses drugs to destroy fast-growing cells such as cancer cells. Chemotherapy side effects include hair loss, nausea, vomiting, and fatigue. Hormone therapy. This is used to treat breast cancers that are sensitive to hormone. These cancers are referred to as estrogen receptor positive and progesterone receptor positive cancers. This treatment include Medications that block hormones from attaching to cancer cells, also called selective estrogen receptor modulators. Medications that stop the body from making estrogen after menopause, called aromatase inhibitors. Surgery or medications to stop hormone production in the ovaries. The side effects include hot flashes, night sweats, and vaginal dryness. Targeted therapy drugs. Targeted drug treatment attacks specific abnormalities within cancer cells. Immunotherapy. Immunotherapy uses your immune system to fight cancer. Immunotherapy might be an option if you have triple-negative breast cancer. This means that the cancer cells don't have receptors for estrogen, progesterone, or HER2. Supportive or palliative care. Palliative care is specialized medical care that focuses on providing relief from pain and other symptoms of a serious illness. Palliative care can be used while undergoing other aggressive treatments such as surgery, chemotherapy, or radiation therapy.